Hi, I'm Dr. Kumar T. Vadivel. I am a board-certified periodontist. For people who need gum surgery and want something non-invasive and less painful than traditional gum grafting methods, I want to tell you about an exciting new technique called pinhole surgery to restore receding gums. The old way of restoring gums, gum graft surgery, took tissue from the roof of your mouth and it was then sutured in place on your gums. The method was painful. Recovery took place in 2 or 3 weeks. You needed a strict diet while recovering, and there were risks of infection. Pinhole surgery is a whole new story. No scalpels are used in the process. Besides being non-invasive, it is also minimally painful. Gum grafting could take multiple surgeries to complete a whole mouth, which could take up to a year. Pinhole surgery can often be completed in one 1-hour session and cover all your teeth. Patients can go back to work as soon as the surgery is completed. Some care is needed afterward, but it is minimal. You will need to see the dentist about 2 days later to ensure that there are no problems. Most healthy people can have the surgery. The main concern is that your gums need to be free of gum disease, but that can be treated beforehand. Pinhole surgery can restore the way your gums look, giving you back a beautiful smile. If you properly take care of your teeth afterward, the treatment can last for years. Having healthy gums are needed to protect the roots of your teeth from cavities.